This is the Desi Doubts podcast. Navigating mental health, societal expectations, and identity is not easy. I'm Dr. Sonalee Joshi, PhD in clinical psychology, therapist, and visual artist.
I'm Rupal Joshi, co-founder of South Asian Americans for Change, single mom, and lawyer. We share our personal stories and the most up-to-date research to give you the tools to figure it out one step at a time.
You don't have to do this alone. You've got this, and we've got you. This is the Desi Doubts podcast, hosted by South Asian Americans for Change. In this podcast, we talk about all things related to mental health and the South Asian American experience. I'm one of your co-hosts, Dr. Sonalee Joshi.
Hi, I'm your other co-host, Rupal Joshi.
And we're joined today by a very special guest. Do you want to go ahead and introduce yourself?
Hi, everyone. I'm Dr. Nithya Cherukuru. I'm a psychiatrist working in the Philadelphia area. I'm also Director of Education for South Asian Americans for Change. Really excited to be here and be talking to you two.
Yay,
Awesome.
We're so excited to have you.
For sure. And we're especially excited to have you here because we've been talking all season about different changes that we've been making with our own mental health, different changes that we want to see our audience making with their mental health. And one of the most important parts of that is being able to recruit good mental health providers on your team, and knowing how to find them can be such a struggle. And we've talked about that too, both of our own experiences and even, as someone in the field, have been challenging when it comes to finding a good provider. And there are so many different names for the different types of providers. There's so many different ways to find people. And so we really wanted to break that process down and think about how to make it a little bit easier for people to go through in a step-by-step process. So we're going to share a little bit about our own personal experiences. We're also going to bust some myths about what it looks like to even find mental health care in the first place. And hopefully have some laughs along the way.
Yeah, I feel like this step it's difficult because you finally get to this place where you accept that you want to make some sort of change in your life. But then you have this like behemoth of a task to figure out, who do I need to go see? What type of person do I need to go see? Is my insurance going to cover it? And like when you're in a state where you're like needing help and, are perhaps like not functioning, it's just a lot to do. So I'm really happy like with the way our resources drafted and the conversations that we're going to have here today, because I know when I was struggling and trying to figure out and find a therapist, like I would have really benefited from somebody being like, these are all the steps and these are the types of people that you can go see. And here is how you do it. Like, proceed.
For sure. And so I think one of the first kind of like keyword definition things that we want to do is just sort of define the different types of providers that are out there, right? Because again, there are so many different people that you can see for your mental health care, and not everyone does the exact same thing. So I'm a clinical psychologist. Nithya, you talked about being a psychiatrist. Mm-hmm. Can you start by going ahead and defining what a psychiatrist does? And then I'll follow it up with what a psychologist does. And then we can talk about some of the other providers that people might recruit onto their teams.
Yeah, so I think the big difference between me and a psychologist or other therapist is that I can prescribe medications. So in my training and my schooling, I went to medical school, just like your primary care doctor or your cardiologist. So we have the same schooling. And then we do specialized training in psychiatry. So I did psychiatry residency for 4 years, and then I chose to do a fellowship to specialize even further. So my specialization is consultation and liaison psychiatry, which is basically the intersection of medicine and psychiatry and vice versa. And then I went even further. And so now I'm working specifically with patients with cancer. So helping them through the diagnosis, treatment, and even into survivorship. I think that probably makes it even more confusing with psychiatrists too. So I do prescribe medications. I do some supportive therapy, but mainly medications. And there are psychiatrists that do like 15-minute med checks. There are psychiatrists that do more extensive therapy as well. So I think having the right questions, which I'm sure we'll get into when you get into that first appointment, to figure out if it's going to be a right fit in terms of what your goals are. I personally, where I work with psychologists as well. So I collaborate with them. I have social workers, other medical providers. So it's a very collaborative environment. In an ideal world, I would love someone to see a psychologist first or try to work through things more behaviorally and learn different strategies. And then if they need medications to supplement that, then that's where I come in. Because medications isn't for everyone, therapy isn't for everyone. So working with other providers and other disciplines can be really helpful too.
Before Sonalee gets into what she does, and I think she's going to answer this question too, so that's why I want to ask both of you. You just said in an ideal world, you would want somebody to work with a psychologist first. So can you elaborate on that a little bit? Why is that a preference? And of course, knowing that every patient is different and there are different situations, but to the extent you can kind of give a universal
and I
answer.
think that is a good point too. Like every patient is different. So there are people that, more serious mental illness or different issues, we do have to address those with medications. So I don't want to, there is a big stigma with psychiatry. There's a big stigma with medications. So I don't want to add to that by saying like, you should go to a psychologist first. There are certain things that you need medications for. But there are also like ways to work through and cope with different emotions and learning how to regulate different things that you're going through that, medications aren't necessarily, they're not going to change your situation or whatever you're going through. They can help you manage it a little bit better, but you still have to learn how to kind of get around and cope with what you're going through.
Got it.
So it would be great to learn strategies for that, and which can be very helpful and just as effective as medications a lot of times. So sometimes, I get two ends of the spectrum sometimes of people who are like, absolutely not, I don't want medications. And then others who only want medications and kind of using that to cope or deal with what they're going through.
Another quick definition, if you don't mind sharing with us. I think some people might hear the term serious mental illness and not quite know what we mean by that. Can you define that for us?
Yeah, so serious mental illness, so various diagnoses, so like bipolar disorder, schizophrenia, so dealing a little bit more with psychosis, really dysregulated mood shifts. And to the point that you're like not functional in your social and occupational settings.
Yeah, for sure.
So Sonalee, you also probably have thoughts on what we just talked about, right? So, and I know you've talked about what you do on prior episodes, but it would be helpful to like see the difference between what you and Nithya are doing in your day-to-day in the context of like this provider episode.
Absolutely. And so as a refresher, or if I hadn't said it before on an episode, I am a clinical psychologist, which means that my training was through a doctoral program, a PhD. And so I did my training with a combination of research and clinical care. And what I mean when I say clinical care is direct providing of therapy. So I was trained in a number of different evidence-based therapies, especially for anxiety disorders, PTSD, OCD, and substance use disorders are kind of my main areas of specialty. I am not able to prescribe medication, though I think in a couple of states there is the ability for clinical psychologists to prescribe with certain credentials or with certain extra training involved. But I'm not able to provide medication. And so I think that is where I totally agree with you, Nithya. It's kind of magical, actually, when you get a good care team around a particular patient. And when you can tell that there are multiple providers really talking to each other about how to best support a patient in their care. Because when you were talking and you were mentioning like, oh, I would really want to start with therapy, I was thinking about all the times where I'm like, oh, I've had someone come into my office and I'm like, wow, they could just really benefit from a little boost of a medication or something to just give them the energy or help with those symptoms that are going to interfere with their ability to engage in therapy effectively. And that's where I want to make a referral to a psychiatrist first and then have them come back into my office. So I think what we're talking about is just the importance of really, one, knowing what you need and where you're at and working with the provider that you're seeing first to figure that out. It's not like you need to know that going in. You may think, I really need therapy, and then find like, oh, hey, I do need that little boost of medication, or I think medication is the only thing that's going to fix it for me. And it turns out you need some of those behavioral tools in order to support yourself first. You can figure that out with your provider, but slowing down and figuring that out and then thinking about who else you need to recruit on your team can be just so helpful. And so just to wind it back a little bit, when people do come into my office, the things that I am trained to do are diagnostic assessment. So assessments around clinical disorders like anxiety, depression, bipolar disorder, schizophrenia. Also things like ADHD and autism. There are specific batteries of testing for that. And we also have a neuropsychologist on a subsequent episode who will talk about what it's like to do testing for like dementia, Alzheimer's, those kinds of things too. So that's what we're trained in. And then we're also trained in the ability to do therapy and evaluations for custody and other kinds of things like that.
Yeah, and I think it's helpful to sort of like contextualize it in terms of like our own personal experience. So I saw a therapist first, like a psychologist first, and was working with a psychologist for quite a long time until, she sort of, said, maybe you should explore, taking, like thinking about whether medication is right for you. And we talked a little bit about it. And then I went to like my primary care physician. And eventually like I went from a primary care physician to a psychologist to sort of like, psychiatrist, which is you. Sorry. See, this is why it's so confusing.
Mix-up happens all the time.
So like sort of like continue with like medication management. But like to your point, Nithya, like I don't think I would have gotten on medication like if I hadn't done all that work with my therapist first. Like if I went to like my primary care doctor or a psychiatrist and they were just like, oh, like you're, you have postpartum depression, like you need to like get on Lexapro or whatever, I'd be like, no, like I'm not doing that. I needed to like have a lot of conversations before I could even like get to that point, which maybe is what you're talking about, like in sort of like a real life example of like working through that stepping stone process before you get to a decision point.
And so we're already starting to kind of talk about those conversations once you're in the room with someone, right? And I think that's so important because once you get in the room, you can start to actually collaborate and think about what your treatment goals really look like. I want to take a step back even further from that because I imagine that there are people listening who are going, yeah, that's great. I would love to get in someone's office, but even getting there can just be so challenging, right? I know we've talked about the experience of like having to call your insurance company again or trying to call a number of therapists and finding that they're full or finding that it's just difficult to find a provider in the first place. So I would love to hear you both kind of talk about either your personal experiences or professional experiences of helping people get to that point where they can even like have that conversation with their PCP, their psychologist, psychiatrist, any other kind of psychotherapist.
Yeah, I can talk a little bit about like how people are referred to me. So I work in a standalone cancer center. So the patients that are referred to me are typically coming through their oncologist, through their other medical provider. And I think, Rupal, like you mentioned, you went to your PCP. So I think checking with your other medical providers and seeing if there's someone within the same system can be really helpful. And some patients who do come to me, I may not be the right provider for them. So if they're looking for either therapy or maybe some other supports, we can kind of work through that and I can help guide them as best I can. I know I even feel bad if I have to like refer out and I'm like, go to this website. But Yeah, I think checking with medical providers, checking on different databases, which can be a whole thing in itself. I know when I was looking once, it was through the databases and kind of just like picking someone who's in my area and works with my insurance company.
One thing that I think is helpful for those of you guys that are probably doing the same thing that I was doing of looking through like your insurance list and whatnot is we put together in our resource pack for this episode some of the databases that are available with, therapists that we're aware of that are very good, and or other organizations that have put together, databases of, like, for example, South Asian therapists, if that's what you're looking for. So that's also like a good place to start.
Yeah, I think I just want to stop and highlight two of the key takeaways that I had from what both of you were sharing. And I totally agree, both from a professional and personal perspective, that you're looking for some way to trust someone without even having met them yet. So it's hard. It's kind of like dating or making new friends in a new space for the first time, right? You're kind of like, I don't know what metrics to go off of. And so the two things that you all highlighted were, one, going through your insurance company, which I think is going to be the most, helpful way from a financial standpoint to know who's in network and who you're able to see. The second thing is any kind of referral. And that could be from your existing providers who know you from a health standpoint, or from friends and loved ones who just know you personally and know what you might need. From another person that you're interacting with. So don't knock those referrals. Talk to your PCP, talk to your loved ones about who they see. Try to get those referrals, because I think that built-in sense of trust can already put you at ease going into a nerve-wracking first session with someone where you're asked to expose a lot. You're asked to share a lot of details about your personal life with someone. So to go in and be like, all right, my PCP trusts this person, has referred patients to them before, or my friend has really liked working with this person. And so there's some kind of level of trust there, I think just really helps the situation feel a little bit easier. Then it kind of comes to doing your own homework and finding the right fit, like you both have been talking about. And I think we think of that as sort of like being in that first session, being in the room with someone, having paid that copay of upwards of, $30, $40, how much ever it is. And then kind of like having that awkward first date with your therapist or with your provider of like, what am I supposed to talk about now? And I think what a lot of people don't realize is that they can do some of that ahead of time as well, through phone calls, through email contacts, through even just like a quick info session before that first session. Have you all navigated those like consultation calls or those first like email contacts before?
Yeah, most practices do offer like a free 15-minute consultation call, especially with like more independent and private practices. So it's really great to have that information beforehand of, is this practice, is this individual going to help in that regard with, again, you're not going to get a good match of personality over that 15-minute call, but I do also want to point out, like, being able to shop around or date around is not possible for everyone.
Yeah.
I know I'm not everyone's like first choice for a provider, but they're, for lack of a better word, stuck with me sometimes. And I think on my end, like, to find the fit on my end, I know what I can provide and what I can help and what information I can give to the individual. And so sometimes it is about giving information and letting them know, maybe I'm not trained in like certain therapies or CBT, which can be very helpful for them. Or if they are dealing with some other psychiatric illness that, we don't have the capacity in our clinic, it's part of my duty to also say, this may not be the right fit on our side. This is where you could hopefully go. And hopefully I can provide some guidance on where to go.
Absolutely. And I try to do the same thing too when people have called the clinics that I've worked in the past, is try to really give them some concrete information about the kinds of treatments that we provide and make sure that from my end, it does seem like the things that they're presenting with are a good fit for those treatments and giving them guidance otherwise, if that's not the case. I think there's also this myth too that like psychiatrists, psychologists, like therapy providers just want business and just want people to kind of come through the door. And that might be the case for some folks. You know, I'm not going to talk for the monolith of mental health providers, but I think for the most part, we want people in our offices who we can help and we can support with the types of treatments that we do and the training that we have. And so I don't want someone coming through my door if they're not going to be ready to do the types of treatment that I have to offer them. I would much rather refer them to the right spot to be able to do that. I have done those kinds of consultation calls and sent those emails when seeking my own therapy in the past. I've done that many times. And one thing that I found over time, even, every time I go back to therapy, is that it actually helps me articulate better the things that both of you are talking about as well.
Yeah.
Going through the process of asking those questions about, hey, what kind of therapy do you provide? Or how do you handle some of these cultural or identity issues that might be important to me? Helps me kind of filter through, even before I've met this person, what I'm actually looking for, and helps me articulate better what I need from the provider at that point in time. That's another reason that even though it's kind of daunting to give some of these people a call or to send those emails for the first time, it's actually really good practice to be able to walk in with a bit more confidence and say, hey, I've actually thought through what I might need in this situation. Are you willing to meet me halfway with that?
Yeah. I want to pause here for a second and just sort of like appreciate the fact that this is a lot of hard work, especially for somebody that's going through something, like thinking about what your goals are, what kind of therapies might work for you. Like doing all of this is a lot of work. And it is absolutely like I remember when I was doing it and I didn't find that like first good fit right away. Like I stopped for a while. I waited for like weeks until I tried again because I just didn't have the time or energy to like function in regular human life, let alone do all of this. And so one thing that I think that I have done for others before that I think, people can do in the community that might be helpful is like when I know that a friend is struggling and they're thinking about therapy, but they can't bring themselves to do like this work. I've said like, hey, like, I know you're struggling. I know you want to see somebody. Like, send me your insurance card. I'll find out who's covered. I feel like I know you pretty well. These are the types of people I think that you'll gel with. Like, I'll give them a call. I'll set some stuff up. All you have to do is like, tell me when you're free. And I feel like that's a great way to provide value to a friend that's going through something, because a lot of times we send a text and we're like, hey, like, I know you're going through a hard time. Like, let me know if you need anything. And then the other person, and I've been this person too, I'm like, oh, I'm fine. Like, thanks. Like, just like, I'll give you a call if I'm like, needing to talk or something. This is something concrete that you can give to a friend to do for you. And it's okay to do that. It's okay to ask for help. Usually when a friend is saying like, can I do anything? Like, they mean it, right?
Mm-hmm.
Like it's not like a fault for the most part. At least I know for me and my friend group, like when I say that, like I mean it. I do want to help. And I have done that for a few people. So if you're lucky enough to have somebody in your community, like maybe you can recruit some help in this search process, like sending these emails that you're talking about, Sonalee.
Yeah, I think recruiting people onto your team from your personal life to help with that is so beneficial. I think taking breaks and setting goals for those phone calls or those contacts that you want to make with providers is also really important. You don't have to go through the process of calling your insurance company, getting a list, and doing all of those emails or phone calls all at once, right? You might say that today's goal, all I can get through today is just giving my insurance company a call. Then day 2 is going on one of these directories and finding people who might match my insurance or the needs that I have for treatment. And then day 3 is I'm going to call 2 or 3 providers on the list that I have, or I'm going to reach out to a friend and ask them if they're willing to help me with this. So it can be a stepwise process, and you can really pace yourself so that you don't burn out before you even get through the door, right? I think that's a really important piece of this too, is just making sure that this feels sustainable so that you can actually get to the place where you can do the work in treatment.
I think it's a lot of pressure to say, like, I think everyone's like, I want to go to therapy, I want to get treatment, and to get it all done in one day or one sitting, that's so much pressure on someone. So I love that idea of like small attainable goals of like, tomorrow I'm going to look at the database or at the insurance card. Makes it feel a little less overwhelming.
Yeah, and a lot of this work that like we're describing, I think, will pay dividends on the back end, right? Like, figuring out what might help, like what type of therapist might be a good fit for you, and figuring out what your goals are, and asking those questions in a consult beforehand, like that'll help in the later end.
Now that we've done the groundwork of giving a number of different therapists a call or providers a call, figuring out who takes our insurance, asking some of those primers, we get in the room with somebody. What do we do from there? Nithya, I would love to hear what your first session looks like with a patient. I'll talk about my experience with that. And then Rupal, I want to hear from your end what it looks like to be on the other side of the couch per se, and what first sessions have looked like for you.
Yeah, my typical session. So after introductions, introducing what I do and how I'm collaborating with their team, I like to hear from the individual themselves why they're coming to see me. And so like what their main concern is. But I am doing a lot of information gathering on this first session because I am determining if we're going to be prescribing medications, if we're going to be changing some of the meds that they're already on. So I want information, again, about what they're struggling with right now, what symptoms are most concerned to them, but also some past history. Have they seen a psychiatrist or therapist before? What medications have they been on before? Any family history? Are they in their social life? Like, do they have the supports that they need? Because am I also helping find additional supports, whether that's like housing, finance, or even like support groups, social support, social workers as well. And then towards the end, I'm doing treatment planning. Again, I don't have to get all the information in the first session, but I do want to get enough that I can make a plan for, when am I seeing you next? Are we going to prescribe medications? Am I going to be referring you to one of our psychologists or social workers on the team? And I want to have we talk about a collaborative relationship with the patients because, I'm seeing you in this one snapshot of time, and I'm depending on you to tell me how you're doing in between. So, if we talk about medications, again, I'm giving you information about it. We don't have a magic test or pill to know what will work or not work. But there are certain ones that might be more helpful in different disease states or interacting with other medications or other illnesses that you might be dealing with. So it's a lot of information gathering. And then if we're prescribing a medication at that time, I give a lot more information about that as well, different side effects you might be experiencing. And maybe we give time to think about it. And then at our next session, we might talk a little bit more in terms of that. But my first session is kind of more so about your symptoms now, history that might be contributing, and then what are the next steps.
I think I take a very similar approach with an eye towards how therapy will go as opposed to medication. I think the things that I would add to that are I usually start with some sort of symptom inventory or some sort of measurement at the beginning of treatment or sort of before someone has even had their first session with me. And the purpose of that is not to, just hand someone a list of symptoms and have them check boxes for no reason. It's for me to really get a baseline, some sort of quantitative baseline of, okay, this is where this person is at now. So we can actually measure progress along the course of treatment. We can actually use this in a scientific way to see if we need to pivot at any point, if those symptoms are actually going down, when we might notice that treatment is over as well. So I'll start with that kind of symptom inventory to get that baseline. Then I think the key word that you mentioned there that I love to share with patients is that collaborative treatment planning. Rupal, you mentioned this, and this is a line that I share with my patients all the time. You are the expert on you. I have expertise in different kinds of evidence-based treatments that, again, may work for people with symptom presentations like yours. So it's our job to come together to figure out what's going to work. If I'm kind of like, it's my way or the highway, or if you're sort of like, this is the only thing that I think is going to work, it often doesn't align in a way that helps us move forward. It's when we can kind of sit down and go, okay, you've got a really busy schedule. So we really want to think about whether or not homework is going to be feasible for you in between sessions. Or, hey, I've been depressed for a really long time. I want to work on my anxiety. What do I do about that? And then we kind of think about like, okay, the depression might take precedence first. And then we use that kind of energy boost to do some really focused anxiety work. So it's coming together, collaborating to figure out what your treatment goals are and how we want to target those in a systematic and effective way that works within the context of your life. And then I also usually give people an idea of how long treatment is going to last, or we want to come up with some sort of concrete idea of like what your life will look like if treatment has gone the way that we hope it will. So I'll often ask people, if you could wave a magic wand and treatment went perfectly and you got everything that you wanted from this course of treatment, what would your life actually look like? People will often say, I just want to feel better. I just want some of those, symptoms to go away. And that's a great goal, but I'm more thinking about what is your life actually going to look like? Are you going to be able to be more of a leader at work? Are you going to be able to play with your kids more? Are you going to be able to do things that you actually enjoy instead of feeling overwhelmed all the time? What tangible differences are you hoping to see so that we can actually measure those things again over time? So that's usually what I'm thinking about in a first session.
I also want to point out, I think tampering expectations or like explaining what, both with therapy and medications, it's not going to be better after our first visit or after your first dose. Unfortunately, most of the medications I prescribe can take a good month at least to build up in your system. So we may not be seeing any changes medically for a month or more. So being able to have that, give it the time and patience with that as well. And that's also the time period a lot of people stop medications or drop out of treatment as well. So having that information beforehand and kind of encouraging them to stick with it is something I really do in that first session as well.
I think that's so critical because it's hard work, right? Just getting into our offices is such hard work already. I always like to say to folks, like, this stuff that you're doing is hard and you don't have to do it, right? Nobody is forcing you into treatment. Nobody is forcing you through the side effects of medication, but you have decided that there is something in your life that is far more important than the symptoms that you're experiencing that's worth going through all of these hard things. And so while we're going through that rough period where people are adjusting to medication side effects or where they're not seeing the benefits of the therapeutic skills that we're going through together, I want to keep at the forefront of our minds, like, why are we doing this? What's the point? What are we looking for on the other side? And how do these practices help us move towards a more sustainable way of living? Because again, we don't want to just do this all at once and have people like benefit for a really short amount of time and then not be able to use those benefits moving forward. So how do we put into place these kind of sustainable practices that are going to last long term? And why are we doing this? What's the outcome that we're really hoping for there?
I think all of this is like getting at the point that like getting this type of treatment is a marathon. It's not a sprint. And I feel like, and I can talk about what the first session is like from my perspective as like, the patient side. But before I get to that, coming out on it on the other side, right? Like this work is never done, but I am at a place where I'm much better than I was before. And so I think in hindsight, it's sort of like the opposite of like boiling a frog in like hot water, right? Where you're like very slowly turning the temperature up and the frog doesn't realize it's boiling. It's like the opposite of that. Like, I don't know I don't know an analogy that is the opposite of that, but it's like time goes by and you're doing therapy and maybe you're getting on medication, and we can talk about this later. And I think we should, because it's very important. Like, your therapy and your medication management is one tool or two tools. There are a lot of other things that you need to be doing or that you may want to do if you really want to make like a holistic change in your life. But anyways, like, when you're consistent, when you're staying consistent, you're doing the things, you're treating it like a marathon or a sprint, you might come out of it 2 years later and be like, whoa, my life is so much different. And like, I am able to handle, so at least for me, like from my perspective of like what my challenges were, like I'm able to like handle so much more than I thought I would, or I can go to like this thing or that thing or stay up later, have these really difficult experiences and like not break down. Like I'm good, but it takes a while. And having those reflection points, I think Sonalee is so nice. Like setting that in the first sort of like session so you can actually measure it is so important. But people think they're going to go into their therapist's office. Once they find their bestie, it's going to be great. They're going to trauma dump on them in like 3 weeks, and then they're going to be a whole new person. And maybe they'll go to a yoga retreat and like, oh, I leveled up to like the next version of me, whatever. Like, I don't think it's like that. And I think that's really unrealistic. And one of like the pitfalls of like having a lot of wellness advice out there, which is why I'm so glad that, we're talking about this.
Yeah, and that it might actually get worse before it gets better.
Yes, yeah, that's true. That's true. Yeah. That period, at least for me, like where I finally got to the point where I was like, oh, okay, I'll get on medication. And then it was going to take a month to work. That month was like the freaking worst. Yeah. Like it was so terrible. But then once it hit, like it wasn't like a snap of the fingers. But again, like 3 months later, I was like, whoa, I like feel a lot better. Like it creeps up on you.
That's also where I think it's so helpful to recruit people in your actual life who know you and are seeing you hit these milestones. Because I feel the same way. Every time I think about medication again, I'm like, I'm the biggest baby. I'm the worst patient, despite being a provider. I think many patients,
Me too.
many providers actually are the worst patients because we like know what we would say on the other end. So I don't know. I just argue with my providers all the time.
They say that about lawyers too. We're the worst clients. If you have a lawyer as a client, it's the worst. I'm definitely a really bad client. I've done that. But anyways.
So admission from all of us that maybe we're the worst patients in the world. But I think one of the things that has helped me be a little bit less of a baby is when I tell my friends or I tell my loved ones, hey, I'm starting this medication for the first time, or hey, I'm trying to use these skills in therapy and it's really hard and I'm really frustrated by it, but I kind of need you to help me hold my own feet to the fire and stick with this regimen to see if it's going to work on the other side. Because often I won't recognize my progress in the way that you're talking about, Rupal, but someone will come to me and say like, hey, you seem a little bit different, or it seems like you've really been working hard on some of these things. And I'm noticing that. And that to me is like, oh, okay, so this is actually working. This is actually going somewhere. And then I'm actually able to reflect on that progress. So not only recruiting people to help you start that mental health journey with your provider, but also on the back end with those milestones, making that progress.
Yeah. Sometimes those changes can be so subtle that you don't notice it yourself. So a lot of times I have patients coming in, they're like, well, I haven't noticed anything, but my spouse likes me better, or like saying I'm arguing less. So there are things that family members or supports can notice sometimes before we do.
Yeah, I think that's totally fair. I mean, I've had that with like our own friends, like in our org, right? They're like, you've been calling me in a panic less often. Like, yeah, things are a little bit better.
Well, I will say, like, Rupal, I've known you for the past few years, but like, so I've seen you on the other end of things, but like, sometimes when you do point out those milestones, it's so nice of like, oh, I would be not handling this as well a couple years ago.
Yeah.
So it's
like
really
I wouldn't be calling you in a panic asking to go on a walk and ice cream like as often as now. Yeah. So
and it's also encouraging to see that too, right? Like when my friends are doing that hard work for themselves, or when I kind of notice a difference in someone because they've started a new medication regimen, it kind of like gets my own gears going of like, oh, okay, that's possible. Maybe I can also make those changes for myself. So it kind of has this nice ripple effect too, where you're all kind of cheering each other on and celebrating those wins with each other.
Yeah. And it comes back to the, like some of the things that we were talking about earlier in the episode too. It's like, if you're not the person that's seeking therapy, but you are someone who is helping or supporting somebody on this journey, this is a good thing to do, right? If you notice some positive changes, even if somebody hasn't said, hey, like, can you keep me accountable? It's still a good thing to say, like, hey, like, we don't have to talk about it if you don't want to, but I just wanted to say that I've noticed X, Y, and Z. And, I wanted to point it out. And I hope that things are going well for you. Like 2 sentences like that can really make a difference to somebody.
And also, I think something I always say in therapy is this is 1 therapeutic hour in your week, right? You have 168 or something hours in a week. And this is one of them. The rest of the time doesn't have to just be kind of like sitting there waiting for your therapy appointment or waiting for your psychiatry appointment, right? We are thinking about how to make changes in this space that are going to help you live a more therapeutically informed life overall. And so that work of talking to your friends about what you need, or sharing your successes, or thinking about how to modify things in your own life to support your therapy or mental health or medication journey, whatever we're calling it these days. I think that's so important. Like I will ask people, like, who is in your corner? Who can we recruit into helping you with homework? How do we make your life also feel like it's a part of this process? So it's not just me and you working on this together. It's you working on this in the context of your larger life.
Yeah. And to the point that it's only an hour, like that first session on this side, like on the patient client side, seems like if you're in distress and you're answering like a questionnaire and sort of giving like the background information, like the first session may seem like, what was the point, right? But this is all stuff that needs to be hashed out for all of the reasons that we just described. And so if you go into that first session and you're like, she didn't even ask me about X, Y, and Z, or we didn't even get into this thing or that thing, like it's only 1 hour. And like, you gotta, like, it's good if your therapist or provider is asking these really important questions and like setting a structure for a plan, and like give it a few like you got to give it some time. Eventually you'll get there. Even like for me, at least the second and third session, and I can't remember like fully because it was a very difficult time and at this point many years ago, but I feel like it took like a good like 6 to 7 sessions to even get her caught up on everything, right? Like to talk about all of what has happened and to really figure it out. And so I think, leaving that first session, it's possible to feel a little underwhelmed, but that's why it's important to set expectations by listening to like, this podcast or looking at our resources. And the other thing I think that we should talk about is like, there is this idea out there that you need to have like this like amazing, like beautiful bonded relationship with your therapist. And like, you're going to be besties. And I feel like that is setting yourself up not for a success. It's already so hard to find a therapist or a provider for all the reasons that we described. And they are not supposed to be your best friend. So, and I know you both have something to say on this. So like the last thing I'll say is just like, I have a great relationship with my therapist and she is amazing. But I think even if I didn't find her, if I found somebody else, like I would have still continued because it's better than nothing, especially if you really need the help. And maybe you keep seeing someone while you search around. Like, I don't know. What do you guys think about that?
I want to contextualize that a little bit because I think there's a balance that you want to be finding with your providers. A lot of the literature out there does actually indicate that therapeutic alliance or that trust between you and your therapist is really valuable in making treatment work, in making treatment effective. So I don't want to devalue that in any way. I think it's important to have a good rapport, good relationship with your provider. But I think the markers that we use to define that are often kind of flawed in the way that we talk about them in social media spaces or just kind of like these general spaces, right? Because there's this idea that your therapist needs to hold all the same identities as you to be your bestie and to have that kind of perfect relationship with someone. There's this idea that, you need to find someone who matches you on age, race, sexual orientation, all of these things. And I have always been surprised to find kind of like who ends up really jiving with my style or who ends up really benefiting. And on the opposite end, too, I was talking with one of our volunteers, Maya Patel, who is responsible for the resource for this episode as well. And we were talking about the idea that like sometimes finding a provider with the exact same identities as you can actually hinder some of that progress, too. Sometimes finding, an older South Asian woman as your therapist, I had the experience of that being like, I'm talking to my mom and I don't necessarily want to share certain things with someone who presents with those kinds of identities. And so it was much more important for my therapeutic alliance to find a provider who instead understood those cultural aspects, but from a more nuanced point of view. So someone who may not be queer, but understands the definitions of different queer identities or understands what it might be like to go through marginalization as a queer person of color. So I think the nuance there that I want to bring back is that trust between you and your therapist is really important. And finding that right fit is really important. But that may not be based on the exact things that you think it might be. And that may take a little bit of time. If your therapist is saying, no, I don't agree with you, or I'm going to push back on some of the things that you think you might need, that might not be a sign that this person doesn't fit with you. It might be a sign that they're seeing something based on their expertise that you might not be seeing. And so if they're disagreeing with you, or if you're finding that in those initial sessions, there's some resistance, that's where I would encourage you to kind of sit with it and see like, all right, what is this person trying to say to me? How are they trying to work with me on this? If you're finding that like, I'm just not really connecting with this person, I'm finding myself like just scared to go into sessions, or I'm finding some big resistance there, I think that's also a thing to listen to. So just paying attention to what you're noticing, writing that out for a couple of sessions and seeing how that goes, I think can be so valuable in building that rapport and finding that right fit. What do you think, Nithya?
Yeah, I think that difference between that trust and alliance versus like someone being your best friend is such a important difference. So like, you might be more comfortable with one provider versus another. And I think kind of looking at like, are you able to tell the truth, some of that resistance that you mentioned, like, am I giving all the information to this provider as well that they may need? I think we also have, I guess it could go two ways. So like some people want your therapist or your doctor to be your best friend, but also going in and thinking that like, oh, they're not going to tell me, they're going to be stone cold, they're not going to give me any information, they're just going to be sitting there in silence. That's not quite what it is either, but we may not give a lot of information about ourselves, and that's completely normal. I think the important thing is, again, like building the trust in the information that we have, and being able to have that like collaborative relationship too.
Absolutely. There's a kind of a joke now, I think, that's going around social media where you, like, people will talk about like, oh, I asked my therapist this question about like her personal life or something, and she just reflected back at me like, well, why is it interesting to you to ask me that question? And I'm like, I've been guilty of
giving our secrets out.
I know. I'm sorry. I shouldn't be sharing, but I feel like people know it at this point. So it's almost a joke of like, oh, why is that interesting to you? Or why do you need to know that about me? And I think I've really kind of changed my tune on that as I've done therapy more and more. And instead, I've really thought about when to self-disclose in therapy such that it's beneficial for the patient, right? I never want to self-disclose because I need to share something or I need to, get some validation from my patient, because that's not appropriate by any means. But sometimes I think it is important for a queer patient of mine to know that I've had some similar experiences to them, or I totally get what it's like to have a big immigrant family and you can't necessarily just like cut them off and set some of those boundaries. So I think, again, we want to preserve, or at least I should speak for myself, when I'm in a therapy space as the provider, I want to preserve this space for you. I want this to be a place where you don't have to think about my feelings. You don't have to think about who I am as a person. This is a one-way street for you to be working out the things that you want to process in therapy. And so I kind of have to be a little bit of a blank space for you to be able to do that. But then again, I'm a human being and I have emotions, and part of therapy is also co-regulating and interacting with another human being and getting some very real feedback from another human being. And so I might offer a reaction of like, wow, that experience that you're sharing with me, that you're sharing with like a blank face and that you've shared 100 times, that's a really terrible thing that happened to you, and I'm having a reaction to that. That doesn't mean that you have to take care of me in that regard. That means that I want to reflect back at you that this traumatic experience that you've had is traumatic. Or I want to reflect back at you that this experience that you're having as a person with a marginalized identity is not okay, and that is an experience that is valid. And I've had similar experiences to that. So again, we want to think about why it is that we're sharing some of that personal information with our patients. And I imagine that's what you're getting at too, Nithya.
Yeah, like that self-disclosure. It's not, like you said, it's not for us. If I'm giving information, it's to help them through something or relate in that way. Yeah.
I'm having like a little bit of a epiphany as you guys are saying.
I kind of saw it in your face a little bit.
I was like, whoa. So I talked about sort of like the two different therapists that I saw. Like I saw the first one and she wasn't a good fit. And then as I was describing that, I was like, wait a second, like how would she be able to set an agenda like if she didn't even know me? And I was thinking back on like why at that time I just really just didn't like feel comfortable with her. And then when I saw my second therapist, like I said, it just felt like an exhale, like she got it. And I felt so safe. And now I'm realizing after you guys are saying this, that the first therapist, like I word vomited, right? Like all of this like crazy stuff that was going on. And I was just like, I need help, And this is not like a dig or like anything like that. Like like I'm sure everyone has like their different styles, but the reason why me as an individual, I didn't feel comfortable with her is like she received it with just like a blank face and then didn't sort of like validate how difficult it was. And then the second therapist, who I still see like now every now and then, she said exactly what you just said, Sonalee, which is like, I just want to recognize that like, this is terrible. And like, you're going through a really tough time. And I said this in, I think, a prior episode that it was during COVID. It was after the lift of like lockdown, but it could only be like 15 people or something like that. She was like, I'm not seeing people in person, but like, you need to come in person. Like you're going through something so tough. You need to come in person and I'll clear my schedule, blah, blah, blah. And then she self-disclosed that she had gone through exactly what I had gone through. And she did that not to, share random parts. She did that to sort of like validate my experience. And that's why I felt so safe with her. So now I know.
I think sometimes self-disclosure can be really powerful. Sometimes really holding space for a patient, like I've worked with several parents who have never gotten to just talk in a room for an hour without considering anyone else's feelings before. And so to come into my office and for me to say, this space is for you. You do not have to think about me. You do not have to think about the experiences I've been through. I don't actually say that, but like, that's kind of how I present. That's incredibly powerful for them. That's the breakthrough of like, wow, you're just here to listen to me. So I think, again, it goes back to this idea of like, we want to empower people to find what's best for them, what they need in that situation too. And that might be someone who really understands your experiences. That might be someone who is there to just say, this time is focused on you 100%, or some kind of in between there too, because we don't do all or nothing thinking here. One of the last things that I want to hammer home, because I know I talked about this a little bit, but I want to get both of your perspectives on this too, is how much identity matters in the context of therapy, how much your therapist's identities matter in the context of the work that you're doing with them. Have both of you thought about how identity matters in therapy or in providing medication management?
I really, really benefited from having somebody who is not my identity. It forced me to, and not in sort of like the negative, like sort of force, but it challenged me to examine a lot of the things that I was struggling with, like when my marriage was ending and when I was dealing with a lot of sort of like extended family issues. It's like, I would have to explain to her why something was problematic in our culture. And as I was explaining it, I was like, and she said it like the first few times, she's like, okay, like I get that that's, an expectation or that's something that you were brought up with, but do you believe that? And then I'd think about it and be like, no, I don't believe that. Like, I don't know why I'm telling that story to myself. And then she's like, okay, well, if you don't believe that, then like, what are the next steps? Like, what are we going to do? And I'd be like, well, I'm going to stop beating myself up for like thinking that this is, the way it's supposed to be, or that I did something wrong when I didn't. And so that was just like so helpful to me. And it actually like has really helped me in like the long term, because now if any sort of like thought like that comes up, I really like take a minute to self-examine and say, wait a second, like, do I believe this thing? Or was I taught to believe this thing that I don't agree with? And I think if I was with a South Asian therapist, then there wouldn't have been, there could have been, but I don't think there would have been that sort of natural challenge of beliefs. So I liked it, and I still like it. I think like I still see my therapist right now, and she's super helpful. So yeah, that's my perspective.
But like for some people, that's like how they learn to relate to that identity better. And they kind of find out certain issues through there. So it all, depends on that alliance and that trust and what you want to work through.
Yeah. It's sort of like two sides of a coin. Like you just have to examine and have an open mind on both sides, it sounds like, to put it all in a nutshell. Yeah.
So I don't know if we've like necessarily landed on a perfect answer of like, this is the perfect therapist for everyone. And this is exactly the cookie cutter of what you should be looking for. And here you go. But hopefully we have given folks some indication of the questions that they can be asking themselves and a little bit of a roadmap to finding that person who is going to be a good fit for them. And hopefully encouraging people to believe that they deserve that, believe that they deserve to advocate for themselves and find a person who is really going to work with them on the things that they're looking for. So I want to leave with maybe a takeaway that each of you has that you want to share with our audience. Rupal, let's start with you. What is one takeaway that you're hoping the audience will have after listening to this episode?
Yeah, so I think one takeaway is there was a lot of information presented on a topic that, and it, rightfully so, because this is a really sort of like dense, time period in people's life when they're trying to figure out how to start treatment. I am a very type A person, and like in this situation probably would have been like taking notes and stuff if I was like thinking seriously about starting therapy. Recognizing that in advance, we put together a resource. We have resources for pretty much every single episode. We put together a resource that has like the definitions of and explanations of what all the different types of providers are, has questionnaires on like the types of things that you may want to sort of like think about when you're looking for a provider. It's just a really helpful like packet of information that you can take away from this episode to like do this work. And so my takeaway is, chew on the episode, and I hope you did, but don't leave feeling more overwhelmed you did than when you started, because we put it all together for you. And of course, like, this isn't everything you'll need, and it's not medical advice or therapeutic advice, but it is just like our little package of things that we thought might be helpful for people to take away to like go on these next steps. And maybe we're making the burden a little bit easier for you to bear.
I love that. Yes, definitely turn to those resources and use them to go at your pace. Again, this is not something that has to happen all in one day, but use it, chew on it, know that we're there with you in this process, know that you've got other people who are there with you in this process, and you'll get through it. Nithya, what about you?
DM us and email us. DM us and email us if you have any questions about the resource. Like we're always around.
Yeah, I think along the same line, I'm hoping this conversation and this podcast is it's a huge step to make that decision of getting treatment or getting therapy. And so I hope we made it at least a little less scary, and that, kind of lean on your supports that you do have, whether that's family, friends, whether it's the resources provided here. And hopefully we made it a little bit easier to kind of seek that help.
Yeah, I would totally agree with that. I think the last thing that I would advocate for our listeners to take away from this episode would be the idea of collaborative care. It's something that we've really been hammering home throughout the episode. You bring your experience to your provider will bring the expertise that they have developed through years and years of schooling or through supervision, and will meet you halfway. And that collaboration is so key to treatment really working, whatever that looks like. So Nithya,
Great.
Thank you so much for sharing your expertise with us. It's always fun to just get to chat with you and have a good time, but also you have such a wealth of knowledge to share with us. So thank you for being here.
Yes.
Thanks for having me. I love being here and talking to you two. And I'm excited for this podcast.
Good chats. Thank you so much. We'll see you all on the next one. Remember to give us a follow on Instagram. If you like this episode and you're feeling extra kind, give us a review on Apple Podcasts or Spotify, wherever you're listening to this, and we'll see you on the next one. The Desi Doubts podcast is a production of South Asian Americans for Change, a 501c3 nonprofit organization. This podcast is for informational purposes only and is not a substitute for professional mental health care or therapy. Desi Doubts is hosted by Dr. Sonalee Joshi and Rupal Joshi. Our special guest for this episode is Dr. Nithya Cherukuru. It's produced by Nima Nardoni, Kirti Chandrasepa, Megha Pathak, and Nithya Cherukuru. It's edited and mixed by Ravi Ray. It was filmed on the Riverside platform. Our theme music is by Rianjali. For comments and questions, email us at desidoubtspod@saaforchange.org and follow us at desidoubtspod on Instagram. If you enjoyed the episode and are feeling extra kind, please also give us a review on Apple Podcasts, YouTube, or Spotify.